Go.
Alrighty, so you'll knock on the door like always, come in, introduce yourself to the patient, use hand sanitizer, explain to them that you're going to be doing a chest and lung exam, and then just make sure you have the proper exposure. So have the patient just remove their shirt, make sure the female's just in a sports bra if that's the case, or if they have gowns present in the room, you can use those. And then just make sure you have your stethoscope on you, and then you wipe that off with an alcohol wipe before moving forward. Then you'll go ahead and you'll start with an inspection of the chest. So you'll want to inspect the anterior sides. I'll have you raise up your arms for me. Inspect the lateral sides. You put those down, and then I'll have you turn around for me. And then you'll just inspect the posterior side of the back. No abnormalities. We'll have you turn back around. And then based off of inspection of the chest, there's no signs of any deformities, no signs of retractions, indicating respiratory distress, no barrel chest due to the AP and lateral ratios being appropriate. So then you'll go ahead and you'll want to palpate the chest for any tenderness and pain. So just start up here. All right, I'll have you turn around for me. Alright, is there any tenderness with that?
No, sir.
Alrighty, so no pain or tenderness noted with that. And then you can turn back around. And then you'll want to go ahead and test for tactile fremitus. So we'll go ahead and start with that, and you'll want to do that on all sides of the chest. So we'll start up here. I'm just going to put my hands on your chest, and I'm going to have you say 99. You're going to have to say it a bunch of times, so just bear with me. And that'll just test for that. So we'll start up here.
99.
Alright, well, we'll start. Let's do it right about here for you.
99.
99.
99.
We'll come down here.
99.
Alrighty. And we'll come back here. Do up here.
99. 99. 99. 99.
Alrighty. And I'll raise up your arms for me. Make sure we got all those. Well, down here, I'll make sure I get that.
99.
Alrighty. So based on that assessment, tactile fremitus, there's equal and symmetrical vibrations indicating no abnormalities. Then before we move on, we'll need to test thoracic expansion. So we'll come back here. I'm gonna put my arms right about here. I'll have you take like a slow, deep breath in and slow, deep breath out. Alrighty, and there was appropriate movement of the hands upon inhalation, exhalation, indicating no abnormalities. And then we'll go ahead and we'll percuss the lung fields, and we'll percuss in all anterior, posterior, lateral sides. So we'll come up here, and I'm just going to tap against your chest, and we'll feel it for anything. So let's see. Sorry if I'm hitting you with that. Alrighty, and then we'll come back here. Percuss back here. Make sure you're just in the intercostal spaces. Oops, sorry, and I'll have you give yourself a bear hug for me. Sorry. Sorry for hitting you. Last one over here. Alrighty. And then based off of percussion, appears to be resonant in all lung fields, indicating no abnormalities. So that takes care of percussion, and then we'll go ahead and we'll go on to auscultation. So before we start that, I'll have you just take like 3 slow deep breaths in, deep breaths out. Alrighty, and while he does that, so then we'll just go ahead and we'll auscultate in all lung fields, making sure that these are pointing forward in your ears. So I'm gonna have you take a bunch of deep breaths in, deep breaths out. If you start to feel lightheaded or dizzy, all that's normal, but if you feel like you're about to pass out or anything like that, just make sure you let me know. Start up here. Let's see. Have you take a deep breath in. All right, over here. Down here. Here. Over here. Do up here too. Make sure I have that right up here. Alrighty, you feeling okay?
Yep.
Alright, we'll go over here. Alrighty, and then we'll come back here. We'll do it on this side. Deep breath in again. You feel it okay?
Yeah.
Alrighty, almost done. One more deep breath for me. Alrighty, so that finishes off just the auscultation in all lung fields, and based off of that, there was no identification of any rales, wheezing, or rhonchi indicating no abnormalities, and that would conclude the exam.